Hi, my name is Vivian Citron. I'll be doing the skills video administration of subcutaneous injection. I'm wearing the correct uniform. I have my badge. My supplies consist of a pair of clean gloves, my needle and syringe, my alcohol prep pad, my vial, my gauze, and the sticky note. The sticky note doesn't have anything on it. That's what I'm showing you. It doesn't have anything. I only have it just so I can show you a close-up of the dose later on. Okay. So for the injection today, we need a 25 to 27 gauge, and it needs to be a 3/8 to 5/8 of an inch for the needle. For the syringe, it needs to be 1 to 3 milliliters. Also, if you see my video become blurry for a split second here and there, it's just my camera trying to focus on me. Okay, now we can begin. So the first thing we're going to do is verify the provider's orders, and then we're going to verify the 6 rights of medication administration, which is the right patient, the right drug, dose, time, route, and documentation. We are then going to check the medication order in the EHR, then verify the medication against the MAR for the first time. We are supposed to do this 3 times before we administer any medication. So the medication I have on hand is heparin, 10,000 units over 10 milliliters, but the doctor has prescribed the patient heparin 1,000 units, subcutaneous times 1 dose. So we will have to do some math, some dimensional analysis, some conversions, etc. For the math portion, what we need to do is we're looking for milliliters, so we would have 10 milliliters on top, and below that would be 10,000 units times 1,000 units over 1. So we would cross out the U, then we multiply across, and then we would have 10,000 over 10,000. So when we divide that, it would equal 1 milliliter. So the dose that we are giving the patient today is 1 milliliter of heparin. Now that I have all my supplies, I'm going to take all my supplies, go to my patient's door, knock on my patient's door, enter the room, close my patient's door, close my patient's curtain to ensure patient privacy. I'm going to put my supplies down on a flat, dry, clean surface. I'm going to perform hand hygiene and introduce myself to my patient. Hi, my name is Vivian. I'll be your nurse today. Can I have your full name and date of birth? I'm going to check the wristband as the patient speaks to ensure to patient verification it is the correct patient. Okay, Mr. Smith, are you allergic to any food, medication, or environmental factors? No? Perfect. Give me 1 second, okay? This is where I would check the medication against the MAR for a second time. So second time out of 3 times. And we may proceed. Okay, Mr. Smith, you've been prescribed heparin, and what heparin is, it is a blood thinner. It is supposed to prevent blood clots in your blood vessels. Now, some common side effects meaning what we expect to happen. That means some common side effects are you may bruise easily, you may take a longer time to heal. The site of injection may also be painful, or it may hurt a little bit. Okay, so some adverse side effects, meaning we absolutely do not want these side effects to happen at all. You may experience a black tarry stool. You can also experience abdominal pain or vomiting in your blood in your vomit. You can also cough up blood. So if any of these happen, you have to let me know as soon as possible, okay? And I'll notify your provider immediately. On a different note, when I give you the injection, you may feel like a slight stinging or burning sensation. That is normal. Do you have any questions, comments, or concerns? No? Perfect. Give me a second, okay? This is where I verify the medication against the MAR for a 3rd time. I'm going to perform hand hygiene and don my gloves. Also, Mr. Smith, you are able to ask any questions anytime if you are confused or have any questions. Okay, so I'm going to use alcohol prep pad. Now these are open due to practice, but in the real world, we would not use an open supply. Okay, we're going to dispose of that in the trash. We're going to wipe the top of our vial. We're going to let that dry. Naturally, we're not going to blow on it, we're not going to fan or anything. So we're going to use this needle today. For the syringe, it is 1 milliliter, and for the needle, it is a 5/8 inch and a 25 gauge. So I'm going to throw that away, and before we actually uncap the needle, we're going to draw we're going to draw 1 milliliter of air because that is the amount of the dose that we're going to give the patient. So I'm going to uncap this. I'm going to insert this, and we're going to then administer the air. Administer the air, and then we're going to then invert the vial. So, and then we're going to draw the medication. We're going to draw 1 milliliter. All right, so do you see some air bubbles? And we're going to fix that right now. Also, I broke my vial, so there may be a bit of medication leakage. That's why it's on the top. Right, so we're going to get rid of any blood clots. Not blood clots, why am I saying blood clots? We're getting rid of bubbles. All right, now there is no more bubbles, and we have 1 milliliter, so we're going to cap the medication, and then I will show it to you. So now that we've capped it, I am going to show you with this. Let me go over. Do you see it? Yes. Now, we're going to put this onto the side like so. We're going to move this medication, and there are 3 sites that we can use. We can use the back of the arm, the upper thigh, or we can use the lower abdomen. Now for this patient, we're using the lower abdomen. And the injection site needs to be 5 centimeters or more from the umbilicus, left or right. We have to make sure that there is no irritation to the skin, there's no inflammation, there's no edema, there's no bruising. We're also palpating to make sure if there is any tenderness or masses. And this seems to be the appropriate site. There is nothing wrong with the skin that I can observe or can see or can tell just from the palpation. So this is the appropriate site. Okay, before we actually administer injection, we're going to pinch the area, and we're going to measure with the needle to make sure that it is 1/2 of the needle from top to bottom, and it seems to be appropriate. You can see from both sides. So now we're going to put this down. We're going to use an alcohol prep pad. We're going to dispose of this in the trash, and we're going to clean the middle, so from the center to the outside. It's supposed to be 2 inches. We're going to let that dry. We're not going to blow on it. We're not going to fan it at all. It is fine. So we're waiting for it to dry. It's perfectly fine. Great. So now I'm going to uncap this. And when we administer this, we have to hold it like a dart, and we have to have palm downward. When we administer it, it must be quick and firm. Quickly and firmly, we have to administer it at a 45 to 90 degree angle. So 45 to 90 degree angle. So 90 degree angle. Okay. Now that it's been injected, we're going to hold it, administer it in approximately over 30 seconds. So slowly administer it in 30 seconds. Okay. We're going to hold it, get the gauze, place it gently over, make sure that there's no bleeding. We're going to dispose of this in the sharps container. And we're going to make sure that the gauze is over gently. And we're not going to massage or press, put pressure, like very forced, like hard pressure onto the area. We're going to check that if there's bleeding. There's no bleeding, so he is okay. I'm going to make sure my patient's comfortable. I'm going to clean up my area, and I am going to take off my gloves. Throw all this away, come here, do hand hygiene, and document my procedure.